I'm Dr. Jacqueline Ngalame. I am a board-certified family nurse practitioner. I am also a board-certified psychiatric mental health nurse practitioner. I work here at the Community Health Center of the North Country, seeing patients of ages 5 and above, and I treat various conditions. My specific role here is to assess, evaluate, and treat psychiatric patients that come for primary care services but are referred here to see me when the clinician notices that there's an issue going on. I also see patients that come for behavioral health services that are self-referred, and also patients that find us online and they come here to see me for a lot of other conditions. And so I am very excited to be here and to be providing these services because they are absolutely needed during this very difficult time. These are very, very difficult times for a lot of people, myself included, healthcare workers. Nobody is immune to what we are experiencing this time, actually around the whole world, not just here in the North Country, over the United States and other countries. So I just want people to know that there is help. COVID-19 has not been easy for no one. Everybody is suffering what COVID has brought to our shores, but together we can beat this, especially for mental health patients. This is a very, very difficult time for most, especially those that are suffering from anxiety. COVID has done nothing but increase their anxieties over things that they otherwise not even worry about. And when you couple that with what they are already experiencing, it's overwhelming and it can be draining at times. COVID-19 has brought a lot of patients into mental health setting. I see patients that have had no issues in the past, but because of COVID, they are now depressed, they are anxious. It's creating a lot of chaos in their work settings, in their personal life, in their social settings. You know, because of COVID, we have to adhere to certain restrictions for the better of all. And this can worsen anxiety in that if you already are isolated, you don't even have people to talk to, you feel like the world is coming to an end. I want you to know that it is not. There is help. Okay, if you are feeling anxiety, some form of anxiety is normal, okay? It is okay for us to be worried about what are we going to eat tomorrow, you know, what is tomorrow going to bring? But when anxiety begins to interfere with your social functioning, occupational functioning, then you need help. Okay, anxiety is okay, but when it begins to overwhelm you to where you don't seem like there is a way out, please, I want you to talk to somebody. Seeking help is not easy. Mental health has been stigmatized, but there is help, and we are here to ensure that you get the help that you need. All you have to do is reach out. Reach out to us. You can send us a message on our website. You can talk to your primary care provider. You can talk to a friend. Please reach out so that we can help you get through these very difficult times for all of us. So what are some of the symptoms you asked that can indicate that you are going through a depressive episode or you are suffering from anxiety? Just look at this. If you have a decreased appetite or a lack of appetite, you are not sleeping or you are sleeping too much, what we call hypersomnia, you are losing weight or you are gaining weight without any reason, and you've lost interest in activities that you previously enjoyed, what we call anhedonia, you lack energy, inertia, you are having problems falling asleep or problems staying asleep. And if these symptoms have been going on for at least 2 weeks, whereas otherwise you were fine and okay prior to that, and if these symptoms are affecting your ability to function in society and also maybe do your schoolwork or engage socially, you may want to speak to someone, a professional. Anxiety is normal, again, like I said, when it becomes overwhelming and kind of numbing, where you worry about things that you should not even be worrying about. You worry too much, you are afraid, you begin to have maybe panic attacks as a result of this anxiety, and it interferes with your ability to function occupationally, socially. You may want to just seek help and speak to a professional that can assist you sort all this out. So there are more symptoms. I'm not just going to go in detail, but these are some of the few things that I want you to look at and say, hey, what can I do? Please just pick up the phone and call us. COVID has made it difficult for some of you and us to meet in person. These are critical things that we do right now to ensure that you do not miss the care that you deserve and need. We have incorporated telehealth or telepsychiatry into our practice. What does this mean? Telehealth or telepsychiatry is the process by which you are being seen by a clinician. You can be in the comfort of your own home, you can be at your workplace, you can be sitting in your car parked and you are seen. This is very, very innovative, and I would like you to consider having a session and see for yourself. How does this work? Telepsychiatry works in that when you are scheduled to see one of us here at the clinic, you get an invitation from the clinician before your appointment. All we need to have on file is an email, and all you need to be able to get this service is a phone, a computer, a tablet with Wi-Fi connectivity. We bring behavioral health services and even primary care services right to your home. So it is very, very innovative, and we are very excited to be offering these services to you. So right now in the North Country, it's snowing, right? It's very cold. Instead of waking up and worrying about gas money to go see a clinician, or oh my God, how am I gonna get through the roads? It's so snowing. It's snowing a lot today. The roads are wide out. You can just sit right on your couch and be seen without having to leave your house. If medications are required, they are sent directly to the pharmacy, and how you have to do is pick them up. Another thing I would like to address in this video is the fact that we have a lot of clinicians here that are qualified and are licensed to see all ages. We treat pediatric patients, adult, geriatric patients, all ages here. And we have counselors. We actually have a new counselor that has come on board, so that will kind of increase the patient volume that we can see, or provide psychiatric and psychotherapy services too. So please, if you are struggling during this time, know that you're not alone. Our thoughts are with you and your family, and would like you to get the help that you need. That is why our organization has gone and taken the steps to be able to provide these services, especially during these critical moments. Sometimes when we are stressed, distressed, or however you want to call it, we cannot think straight, right? We have problems kind of even figuring out what the next step is going to be or what it should be. This is where seeing a professional is very, very important and key. Why is it key? It is key because when you see a professional or you speak to someone else, there's another perspective that is being, another head comes in. As they say, a problem shared is a problem solved, or a problem half solved. When you are alone, the options may seem limited, but with someone else talking to you and trying to figure things out, you see that there are a lot of other options that you can take than to just sit and worry, right? That's why seeking help is very important. Also, we have when you seek help, you know that you are not alone and that somebody is listening to you and helping you talk through your problems and figure out a solution. Talk therapy is very important. When you remain isolated, you might feel like the world is crumbling, but when you expose yourself and you become vulnerable by expressing what you are internalizing, just talking about those things is therapeutic in a way. Because when you air things out, you relieve the burden that you are carrying and share with somebody else that can help you problem solve. So this is very, very important to take note. Again, we are here, we are open, we are online. So if we can be of service to you, please reach out. We are in this because we want to help you and we want you to succeed. Don't worry about, I don't have money, I cannot pay for it. Just reaching out, we can even refer you to resources that will help you not just for your mental health, but in other areas in your life, because we have case workers, social workers that will work with you to figure out what resources might help you live a better life, right? We provide a holistic approach in what we do. We do not just treat the symptoms, we treat the whole person, okay? For you to live life to the full extent that God has wished for you, we take into account everything that is going on into your life, and we try to determine what resources could be beneficial to you and refer you to those as needed. So it is more than just seeking behavioral health services. Reaching out is what we want you to do, and we are here for you. Please pick up the phone, send us an email, call us, and let's ensure that 2021 is bright for everyone. Thank you.